Hello everyone, I am Dr. Javeed Hussain, consultant robotic and laparoscopic surgeon from Medicover Hospitals Bangalore. So today our topic of discussion is about hernia. So you might have come across many patients suffering from hernia, which can be from inguinal region and also in the umbilical area, that is called umbilical hernia. And the main reason for hernia is because of a defect in the abdominal wall, which can happen in the newborn babies and it can reach up to 80 years of age. So basically there are abdominal wall muscles where the strength is provided by these muscles to the abdominal organs. When there is a defect because of congenital reasons or because of weight gain or because of lack of muscle tone, the intestines will try to protrude from these hernia defects like this. Here the intestines are coming via this hole. This is called a hernia, wherein the intestines are protruding out. So in these conditions, the patient will have bulge, which can be noted on the abdominal wall on coughing or straining or lifting heavy weights. And whenever the patient tries to bend, the bulge becomes more. And when they try to lie down, the bulge becomes less because of the intestines moving back into the abdominal cavity. So, what are the treatment options and how do we investigate? The basic investigation is by clinical examination, wherein you can meet the surgeon and we will do a preliminary examination, wherein we will be examining the swelling and we will try to know whether there is a fat coming out or something else. The next level is by an ultrasound scan, and wherein we will be subjecting the patient for an ultrasound, wherein we can see the content as well as the size of the defect of the hernia. And in larger cases, there may be a requirement of a CT scan. After this preliminary evaluation, we subject the patient for a surgery. There is no medical treatment for hernia because this is a mechanical defect. The most common question people ask is, can we deal with this with medicines? So the answer is, it requires surgery. And patients ask us, how early should we do or can we defer the surgery? So the primary area of interest is the surgical treatment is by reduction of the contents back into the abdomen and by placing a mesh to prevent recovery. So the basic laparoscopic surgery which we do is painless, and we are also offering robotic surgery for hernia repairs, wherein we operate via the help of a Da Vinci robot, which is more technically advanced and pain. The repair is moving the intestines back into the abdomen and putting a mesh to prevent further recovery. So laparoscopy and robotic surgery are virtually painless and patients get discharged on the very day. Regarding the timing of the surgery, many patients try to defer the surgery thinking that there are no symptoms. But the problem with hernia is when the intestines come out like a bulge and they are not going back again. That means the patient starts suffering pain with vomitings and the bulge is not going down. This is called an obstructed hernia or a strangulated hernia, wherein the intestines are getting stuck in the hole. This is kind of an emergency setting where a slight delay can lead to gangrene of intestine and it can lead to devastating complications. So, if the bowel is gangrenous, then the further advanced surgery can be required. In any cases, the placement of mesh is the cornerstone of hernia surgery. And also the same story happens with the umbilical hernia or any other hernia in the body. So if you or any of your friends are suffering from hernia, please try to contact a nearest doctor. And if you are living in Bengaluru, you are most welcome to Medicover Hospitals Bangalore. Thank you.